I felt like it was hurting me a little bit professionally, you know, I actually had someone come to me, a colleague, and kind of confide in me as a friend and say, hey, look, buddy, you really need to get that taken care of. And yeah, at that point, really up until then, I kind of really thought in my mind that, well, the only person who really noticed is my wife. Nobody else has really noticed. Maybe Mom. I'm sure Mom has noticed. But, you know, I really genuinely thought in my mind that, you know, people I work with, the people that were close to me, didn't notice. And I knew I was going to have to go to a dentist that would be able to really help me get through the pain. Whether that was, I didn't know what was out there, whether it was going to be, you know, tranquilizers or whatever it may be, you know. And I'd heard nice things about Dr.Reece. Some folks in my office had been to him. And not to mention he was right across the street from my office, which was really convenient as well. And picked up the phone and called, and a really sweet voice answered on the other end. And it was Kim, one of Dr. Reece's assistants over there. And I had maybe a 5-10 minute conversation with her on the phone. And I told her, I said, look, I would just like to come over and just talk with someone. I don't really want to talk to the dentist just yet, but if I could just kind of come over, you know, kind of under the radar, so to speak, and just ask a few questions that I have, I would love to do that. And to my shock, she came back and said, well, can you come right now? And I went, I guess so. Yeah, sure. And I sat there at my desk for a few minutes, walked over to my boss, and I said, look, I've got something I need to go do. I'm going to be out maybe 20-30 minutes tops. And I ran across the street, and she was waiting for me. She was literally standing up, waiting for me to come in. I walked in, and the rest is history.